first, we need to prepare ourselves. So we need to wear appropriate scrub suit, complete scrub suit for DR. And then we need a cap and then the mask. Also, we need plastic apron and goggles. And lastly, we need to wear rubber closed slippers.
First stage. Stage of cervical dilatation and effacement. It starts with the true label contractions and ends with fully dilated cervix. This stage is divided into 3 phases: the latent, active, and transition phase.
Magandang hapon po, ma'am. Ako po si Task LAYLAY LAQUEO, isa pong student nurse ng SLSU. Ano pong pangalan ninyo?
Po si Christine.
So now we will take and monitor the vital signs and the progress of labor. So the partograph, the cervical dilation, the effacement, as well as the fetal heart tones and the vital signs. Kukunin ko naman po muna ang blood pressure.
Obtain the blood pressure. Obtain the temperature and oxygen levels. Then, get the pulse rate.
And now we will monitor the fetal heart tone. So ma'am, magandang hapon po. Titingnan ko naman po ang tibok ng puso ng inyong pong bata. Okay po? So now we will provide health teachings. So ma'am, magandang hapon po ulit. Kung masakit po ang inyong tiyan, maaari po kayong tumayo at maglakad-lakad. O kaya mag-squatting rin po tayo para po mawala po yung sakit po sa atin tiyan. Ano po? Ayos lang po. Tsaka din po, pag kayo po ay nahihirapan sa paghihinga po kayo sa inyo pong dibdib. Okay po? Hindi po sa ating tiyan. Mabagal lang rin po at malalim po. Okay po? Sige po nanay, squat po tayo. Tayo po.
Encourage to void every 2 to 3 hours because a full bladder inhibits uterine contractions. Encourage upright position or walking. Squatting elongates the pelvic floor muscles and makes it easier for a baby or stool to evacuate.
Inform the mother on progress of labor. Encourage and praise the effort of the mother.
Apply sacral pressure to suppress pain transmission to the brain.
Medications should be readied. Pain relief during labor and delivery may employ analgesia and anesthesia. These drugs are not without risk. Therefore, the benefits should always weigh the risk. The partograph is a tool for monitoring maternal and fetal well-being during the active phase of labor. There are maternal indicators, which are the vital signs, time of spontaneous or artificial rupture of the membranes, uterine contractions, urine output, and the drugs administered. The fetal indicators are the fetal heart rate or fetal heart tone, the amniotic fluid, and the descent of the fetal head, as well as molding.
For assembling the DR set, first, we need to observe proper hand washing, and hand hygiene. Then, we can get the DR set and assemble the mayo table.
Use the soaked oven forceps to open the cover. Arrange the DR instruments according to use. First, Alice forceps. Alice forceps is a surgical instrument with sharp teeth used to hold or grasp heavy tissue. Scissors for episiotomy. And cord ligation. Obtain the Kelly forceps and ovum forceps soaked in antiseptic solution. Open the lid and place it upside down to avoid contact from a contaminated surface. Thoroughly rinse the instruments. Ovum forceps. Ovum forceps is used to grasp, hold, manipulate, and remove tissue from side of the uterus, including the ovum and placenta. Tissue forceps and needle holder for episiotomy. Serve the cord clamp. Syringe. Sanitex and cotton balls with betadine. Then cover the instruments with sterile towel. Second stage of labor, delivery stage or fetal stage. It starts with full cervical dilatation and ends with the delivery or expulsion of the baby. Contractions are strong. Duration is 60 to 90 seconds. Frequency is 2 to 3 minutes. Proper gloving is important to avoid cross-contaminations. Double gloving is done in the delivery room for the delivery of the baby and delivery of the placenta. Coach mother on proper pushing or bearing down during contractions.
So ma'am, pag kayo po iiri, hawak po kayo sa bakal, hawak pong nakabukas ang bibig at wala pong ingay. So ang pag-iri po dapat po ay inhale, exhale, tas hold po kayo. Iiri lang po kayo kung meron na pong hila. Ito. Huwag po kayong, at saka po pati huwag po agad babawi. Unti-unti lang po ang pagbawi.
Monitor contraction, maternal, BP, and fetal heart tone.
Okay.
Sige po. 1, 2, 3.
Unti lang po. Unti lang po. Inhale, exhale, hold, push po. Titingin po kayo sa inyong tiyan, wag po paaba po nairi.
Provide physiological support, inform mother on progress of labor. Transfer to the delivery room for primigravida when cervix is fully dilated with bulging of the perineum. And for multigravida is when cervix is 8 to 9 cm dilated. Practice strict asepsis to prevent sepsis. An episiotomy can be performed to prevent tearing of perineum to shorten second stage of labor.
Okay. Sige lang po. Buti-buti lang po ang paghilab. Buti lang po ang pagbawi. Yan.
Sige po, nanay. Sige po po.
Sige po. Sige po. Pag sinabi po namin tumigil po kayo, tigil na po ang iri.
During crowning, apply Ritgen's maneuver. Place a sterile towel over the rectum, pressing forward to the fetal chin while the other hand presses forward on the occiput to facilitate extension of fetal head.
Sige po, nanay. Malapit na po. Sige po.
Sige lang po. Unti-unti lang po ang pagbawi. So tigil na po ma'am, tigil na po. Ayan.
Baby out. 1:45. Baby boy. No cord loose. Clear meconio.
Wait for the pulsations to stop before clamping the umbilical cord.
Yan. Ito po ang inyong anak.
Observe for placental separation, such as Culkin's sign. Uterus becomes mobile and rises up in the uterus, sudden gush of blood, and slight lengthening of the cord. Third stage of labor, placental delivery. It is the stage of placental separation and delivery which with the delivery of the baby and ends with expulsion of the placenta.
Placenta out. 150. Schultz.
Essential care. Do not hurry expulsion of placenta. Apply Brandt-Andrew maneuver. Track the cord slowly. Apply cord traction with counter traction. Note the time of the placental delivery. Should be 20 minutes after delivery of the baby. Inspect for completeness of cotyledons. Palpate uterus to determine degree of contraction. And inspect perineum for laceration.
Bisa ka. Bisa.
$120 over 80 BP. So ma'am, tuturuan ko po kayo. Ito po ay parang inyong pong mattress ay bumalik.
Fourth stage of labor, recovery stage. This is the period of 1 to 2 hours after the delivery of placenta. This is considered dangerous for the mother as she can have hemorrhage and uterine atony.
So magandang umaga po ma'am. Ako po si Kurt Cyrus Laqueo, isang student nurse ng SLSU. Ano po ang pangalan ninyo? Okay. Now we will conduct the vital signs every 15 minutes. So titingnan ko po muna ang inyong temperatura. Habang po kinukuha namin ang inyong temperatura, tingnan na rin po natin ang inyong oxygen. Tira po ng inyong kamay. Okay po. Tingnan ko na po ang inyong temperatura. Okay. So ngayon naman, titingnan ko naman po ang inyong pulso, patingin lang po ng inyong kamay. Okay po. Check the vital signs or the pulse for a full minute. So ngayon naman po, titingnan ko naman po ang inyong paghinga. Ayos lang po ba yan? Count the respirations for a full 1 minute. So ngayon po ay titingnan ko naman po ang inyong presyon. Maaari po ba? Okay. Relax lang po. Titingnan mo rin. Sige po. And now we will palpate the fundus and determine its location relative to the umbilicus every 15 minutes. So ma'am, titingnan ko naman po ang inyong mattress. Maaari po ba yan? Sige po. Expose. Within 24 hours, the fundus should be at the level of the umbilicus and should be hard and contracted.
Assess the fundus for its consistency. If relaxed, massage until firm, but do not over-massage as this can tire the uterine muscles, causing relaxation. If displaced to side, feel lower abdomen for distended bladder and make sure bladder is empty before fundic height determination.
So now we will check the patient's lochia.
When assessing the lochia, there is 3 types: rubra, which is dark red, serosa, which is lighter pink, or alba, which is clear or yellowish. The lochia must progress to a more lighter color as time progresses.
Now we will check for the patient's bladder distension. So ma'am, hahawakan ko lang naman po ang inyong tiyan. Maaari po ba? Sige po. And now we will check for the patient's perineum. So, ma'am, titingnan ko naman po ulit ang inyong baba po. Maaari po ba? Sige po.
Note the general appearance, redness, swelling, bruising, and the vaginal bleeding of the perineum.
Time to provide comfort, provide fluids and foods as tolerated, such as small, frequent feedings, and then provide bonding. So ma'am, na ito po ang inyong anak. Hawakan po ninyo siya.